Hi everyone, my name is Sky, and for my Module 3 discussion board, I decided to watch the movie Girl Interrupted, which came out in 1999. Question 1 is: how is the character shown to be mentally ill? Discuss how the character is portrayed in the film. Susanna is shown to be mentally ill because in the beginning of the movie, she attempted suicide by taking a bottle of aspirin with vodka. After attempting suicide, she was rushed to the emergency room, and in that scene, we notice Susanna inflicted self harm to her body, specifically her wrists. She had bruises all over her wrists, and she was informing the doctor that she did not have any bones in her hand. Throughout the movie, we also see how Susanna isolates herself from a lot of people. We see that she is involved in many relationships that have no meaning to her, and she's not afraid of the circumstances and risks that come from being in those certain relationships. Does the film say what the condition is? If so, how is the condition diagnosed? The film does say what the condition is. Susanna was sent to a psychiatric hospital after a failed suicide attempt. She is diagnosed there with borderline personality disorder by a doctor. What is the diagnosis criteria for mental illness depicted in the movie? For borderline personality disorder, the diagnosis criteria for the mental illness depicted in the movie involved depression, feelings of nervousness, negative feelings of past experiences and future events, chronic emptiness and boredom, loss of desires for life, self harm, loss of energy, disturbed attention, intense fear of abandonment and rejection, engaging in impulsive actions, experiencing intense anger, and suicide attempts. Susanna remembers herself as, all her life she was like this, not cheerful and never smiled. Borderline personality disorder is accompanied by a chronic feelings of emptiness, intense out of place anger, paranoid thoughts, and a cycle of unstable and intense interpersonal relationships. Does the character meet the criteria listed for the diagnosis you looked up? Yes, the character in Girl Interrupted does meet the criteria listed for the diagnosis I looked up. In the National Library of Medicine, diagnostic criteria of borderline personality disorder involves frantic efforts to avoid real/imagined abandonment, patterns of unstable and intense interpersonal relationships, identity disturbance, impulsivity, suicidal behavior, instability due to marked reactivity of mood, chronic feelings of emptiness, inappropriate intense anger, and stress related paranoid ideation or severe dissociative symptoms. Susanna meets all the criteria listed for borderline personality disorder. In what ways does the movie accurately represent the disorder and or misrepresent it? Explain your answer using specific examples from the movie. The movie accurately represents the disorder because Susanna meets at least 5 severe symptoms of borderline personality disorder from the 5th edition of the Diagnostic Statistical Manual. One criteria involves suicidal thoughts and doing things to attempt suicide. We see in the beginning of the movie Susanna attempts suicide by taking a bottle of aspirin with vodka. A second criteria is inflicting harm on the body by cutting or bruising. When she is admitted for suicide, we were able to see in the emergency room that everyone was trying to help her wrist because she had bruises. A third criteria involves Susanna trying to be in a relationship to avoid feelings of abandonment. We see in the movie that she is involved with a teacher and a guy she met after high school graduation. We see that she is having unsafe sex and staying in relationships to feel wanted and not rejected. The fourth criteria involves feelings of emptiness. She felt throughout most of the movie that nothing was going her way and how she imagined it. The fifth criteria that Susanna falls under would be a shift in moods and no sense of herself. In the movie, we see Susanna convincing herself that she would never get better and she would get defensive with her doctor when they would speak about her diagnosis. How's the illness treated in the movie you chose? In the movie Girl Interrupted, Susanna was treated for her illness by having therapy sessions with Dr. Wick and a group treatment. The group sessions were referred to as milieu therapy, and it involves using everyday activities to help people with interaction in community settings. What other treatments are available? Yes, there are new therapies available for borderline personality disorder. Dialectical behavior therapy is currently the most widely utilized evidence based treatment for borderline personality disorder. When Susanna was hospitalized, this treatment was not yet available. If Susanna's BPD diagnosis was wrong, the choice of dialectical behavior therapy may still be a successful treatment because it is an excellent treatment for severe depression and suicide. What are some possible occupational therapy interventions or possible OT treatments you could use with this character? Some possible OT interventions or possible OT treatments I could use with Susanna would be social skills training. I believe training in social skills will teach her how to express her feelings and needs in order to increase her chance of success and fulfillment. Lack of adequate social skills, empathy, etiquette, ability to resolve conflicts are all symptoms of borderline personality disorder. By using social skills training, occupational therapy practitioners can optimize the social functioning of individuals with borderline personality disorder by enhancing specific skills such as identifying and mending problems in social relationships, daily life, work, and leisure. What safety concerns may need to be considered while treating this client? Some safety concerns that may need to be considered while treating Susanna, who has borderline personality disorder, would be that she is most at risk for attempting suicide or participating in high risk activities. In Girl Interrupted, we see how Susanna attempts suicide and discusses death with her peers. Suicide is something that she is continuously thinking about throughout the film. Without a safety strategy, Susanna will run a risk of hurting herself or another person. A safety plan can lower the risk and decrease the likelihood that Susanna will take a snap decision that will have a negative outcome. What are the false statements or depictions of mental illness in the film? In Girl Interrupted, we see that borderline personality disorder is not taken as seriously compared to the other patients' disorders. The head nurse in Girl Interrupted tells our main character that she is just lazy and self indulgent. And the psychologist in the film suggests that Susanna can just choose to get over her mental illness. It is a false statement that individuals with mental illnesses can just choose to get over their diagnosis. Are there accurate depictions? How do you know? The movie does contain accurate depictions because people with mental illness are very likely to be victims of violence and abuse. We see this with the character Daisy in the movie. She is a patient diagnosed with OCD and an eating disorder that was stemmed from abuse from her father. In the diagnostic criterion for borderline personality disorder, it involves being impulsive. Susanna is seen being impulsive in the film by being promiscuous and participating in sexually impulsive way. She engaged in a sexual relationship with a married teacher and did not care about the consequences. We even see Susanna kiss an employee at the mental hospital the same night she has sex with a male she engaged with before entering the facility. Borderline personality criterion involves self-harm and thoughts of suicide, and Susanna attempts suicide and has bruises on her wrists. It is also proven that individuals who struggle with borderline personality disorder manage their symptoms better when they have an effective therapeutic approach. In the film, we see that Susanna's visits with the psychologist helps her little by little each session. Why are aspects of illness so misrepresented? I think some aspects of borderline personality disorder are slightly misrepresented in the film because it shows how Susanna is completely cured at the end of the movie. Yes, she is going to continue seeing her therapist, but most individuals with borderline personality disorder have treatment for many years. Susanna was only at the facility for 18 months. Another aspect that was misrepresented is that those with mental illness can just choose to get over their disease. Mental illness is a serious issue, and it takes a lot of time to heal completely or even be able to manage their disease with therapy and medications. Lastly, this is my reference slide. These are all the references that I used throughout the PowerPoint presentation. Thank you all so much for watching my presentation today, and I hope you enjoyed my analysis in all the questions that were asked. Thank you.